Prof. Pangestu, welcome to In Conversation.
Pleasure to be here. Thank you.
One of the very major criticisms at the moment is that China may not be disclosing all the data.
Okay.
They may not be being upfront about how many cases there are who are infected and who have died.
No, I don't believe that is true for a couple of reasons. First, I think following what happened with SARS in 2003, where it came out quite clearly that China actually covered up what was happening for about a month, even longer, and then by that time the outbreak had spread all over the world. I believe they learned a lesson from that, and evidence showed that after 2003, after SARS, they were much more open, they were much more transparent in sharing data. I think 2 years after SARS there was a Shanxi earthquake, and immediately they shared data, information, fatalities, and that allowed the international community and WHO to mobilize help. So, and what I've seen so far is that the Chinese government has been very open, importantly very timely in sharing data about the virus, about the disease itself, because they realize that this is a matter of international solidarity. You need to sort of look after not just your own country, but the whole world, obviously immediately for Asia. So I don't believe that they've been hiding anything. Having said that, of course, because this outbreak is changing all the time, okay? And people may say, oh, you're not telling everything, but they're not telling everything maybe because sometimes they don't even know, because it's changing all the time.
In other words, the data is incomplete.
Exactly. I think it's more of a question of them still being overwhelmed by the amount of testing that they have to do, both amongst people who are well as worrying about asymptomatic people. There could be limitation on laboratory capacities, availability of tests, etc. Plus the added burden of now using CT scans. That is, I think, going to continue because the situation is still quite severe in China, and clearly it's probably within China at least it's going to continue being quite serious for some time. So once again, I do not believe they are hiding or massaging in any way. They are just doing the best they can with what they have.
But I'll come back to this with the China criticisms.
Yeah, sure.
It's come from the US, which one can say is ideologically based,
Yeah.
but some of it's also been domestic. For example, the case of the doctor who criticized, who said that yes, he thinks that there's an outbreak, and who subsequently has unfortunately died as well from the virus. They would say, why wasn't something done at that point when he was whistleblowing, raising the flag?
Sure. My own take on this is that although I think the Chinese government at the level of, let's say, the Ministry of Health in Beijing has been very open, very transparent with WHO and globally in terms of sharing the data, I believe that there is still a bit of a gap between what happens at the central level in Beijing and what happens at the provincial level, okay, in Hubei province, and of course at the city level in Wuhan, okay. So that lack of communication, a little bit perhaps of hierarchy and bureaucracy led perhaps, okay, this is just my own view, the Wuhan mayor and the local provincial authorities not being able independently to say, hey, this doctor may have something here. Let's give him a chance. They were probably sort of, let's say, they probably had instructions to sort of say, don't share anything prematurely that can cause worry and panic. So I think that was perhaps one of the reactions behind it. So it's a lack of, let's say, communication and understanding of the urgency of certain situations between the central government, provincial government, and the city government.
ordinary person, when you say that the World Health Organization has put out a public health emergency declaration, it sounds extremely serious and rather frightening. But the WHO actually has put out and made declarations like this before. The coronavirus that we're seeing now, this is not the first time.
Yes, it is actually the 6th time that a public health emergency of international concern, we call it PHEC, has been declared. The previous ones have been related to Ebola, twice, once in 2014-15, and the other one just 2018-19. There had been others for polio, also for Zika, and also for swine flu. They call it H1N1 swine flu in 2009. So it's not the first time. This is actually the 6th time this PHEC has been declared.
When we say global health emergency, everybody thinks, oh gosh, that's really frightening. But when you say, for example, polio, for most of us, polio doesn't rank as something to be that scared of.
Sure. Let me explain. The polio declaration on PHEC was not so much that there was an epidemic, but there was a concern about immunization rates falling below a certain level and therefore potentially causing an outbreak of a very serious disease, whereas all the other 5 were related to outbreaks. So the polio one is a little bit different.
The other thing that people talk about is the flu. The flu kills between 350 to 650,000 people every year.
Yes.
And this is according to WHO's own prognoses.
Sure.
So why isn't flu a special emergency, terribly frightening?
Sure. I think the main reason for that, Lynn, is that with diseases like flu, and the other example important to the region is dengue. Okay, so we, in a sense, people have gotten used to it being part of their everyday lives. Okay, and yes, you're right. Every year, flu kills a lot more people. So does dengue, but they do not sort of appear out of nowhere. Okay, like this new coronavirus, it just came out of nowhere. Suddenly there was this huge outbreak. So there is that element of surprise. With it together, there's an element of panic and hysteria of the unknown.
So are you saying that this current COVID-19, what we're seeing is a hysterical reaction?
I would say that on the part of the public response, there has been a little bit of a overreaction, a little bit of a panic setting in. Now, having said that, going back to your previous question, how does WHO declare a PHEC? Okay, it's not based on sort of what WHO people hear on the news, but it is very strictly science and evidence based. But the other thing I need to perhaps add from a WHO perspective is that it's a classical situation. If they do, they are damned. If they don't, they are damned. Okay, you take H1N1 swine flu in 2009. Okay, WHO declared a PHEC. Singapore raised their alert to orange. In the end, nothing happened because the disease, although it spread, was very mild. Okay, and the reaction then was, oh, WHO overreacted. It caused panic, it caused economic losses, societal disruption, etc., etc. So we were condemned for overreaction. Okay, so in this case, they thought about it very carefully. As you know, they took some time to declare this. Okay?
We're criticized for it as well.
Criticized for the delay.
Yes.
Okay, but the delay to me is entirely justified. And at the end of the day, as I always tell my students, whatever decision you make, base it on the scientific evidence. By declaring a PHEC, they can convene, they can mobilize organizations like the World Bank, like the European Union, okay, to say, okay, you guys, we need your help for countries, developing countries that do not have the capacity.
One senior official at the Ministry of Health in Indonesia has implied that a major problem is the cost of testing all the people who are in quarantine or who might be suspected of the virus.
Yes, of course. I think the Indonesian Ministry of Health obviously has many other problems to deal with. And I think every time something like this happens, there's a real danger of limited resources, okay, being suddenly diverted into an issue that's the heat of the moment. I've been in touch with our Ministry of Health. I don't believe that we have the same test kits supplied actually by the US CDC. So I don't think that's an issue. The issue is that these kits are available in Jakarta at the let's say the laboratories or the Ministries of Health, but they may not be available out in Bali or in Papua. Bali, I'm not concerned. I think they are very well equipped. But in other parts of Indonesia, you know, they may not have that same capacity. Indonesia is not one island of 700 square kilometers. It's 3,000 islands spread across 5,000 miles. So the logistics of testing and confirming potential coronavirus cases is huge. And this is where once again I go back to the role of WHO. When WHO declares a PHEC, like in this case, it allows the organization to mobilize help and resources from other countries, including the US, the European Union. Okay, we declare emergency, you help Indonesia by supplying these kits. Whatever amount they need, fly it out, give them the kits so they can then test more suspected cases.
So this is one of the vital things that people may not always realize as a general public, that part of the reason also for declaring an emergency would mean that you could help developing countries.
Right. I mean, I mentioned the possibility of the international community as a result of a PHEC coming together, helping Indonesia. More importantly, what happens if COVID goes to Africa, okay? And that's one of the reasons the PHEC was declared. Now, those countries are even more limited, both in resources as well as human capacity to do testing of this COVID. Now, if you imagine after the Chinese New Year, and as we know because of the Belt and Road Initiative, hundreds of thousands of Chinese workers are going to go back to Africa to continue whatever projects they're working on. Now, if any of them carry the virus and it spreads within some of these African countries which have limited healthcare capacity, that's going to be another major issue.
A lot of the social media worries about the coronavirus. Misinformation, how do we deal with misinformation concerning the coronavirus?
As the famous writer Yuval Noah Harari wrote in an op-ed in the New York Times last year, we humans know more truth than any species on Earth, yet we also believe the most falsehoods and fake news and misinformation. So what we are experiencing now, WHO describes it not as an epidemic, but as an infodemic. And I am convinced that misinformation, fake news, has actually made the situation worse. Now, this was not the case 18 years ago with SARS. We do not have this very rapid spread, viral spread of fake news. Okay, so that's one of the reasons why this coronavirus outbreak has spread much more rapidly. To its credit, the WHO has tackled this head-on. WHO has been engaging with about 20 big technology companies, okay, to deal exactly with how to limit misinformation regarding the coronavirus. Pinterest is one of the research platforms. Now, if you put coronavirus into Pinterest, you end up with a link to a site called Mythbusters, which is hosted by WHO, to clarify things, okay? Google has put in something called SOS Alert, and that also goes to the WHO website, to the WHO Twitter account in 6 languages. English, Chinese, Spanish, French, Russian, and Arabic. Very important. Third example, WeChat, which is the WhatsApp equivalent in China. They have also linked to WHO Twitter account, and WHO has translated it into Chinese.
But an ordinary person on the street, someone watching this show, could turn around and say, but you scientists, you don't even agree. You give differing views as well. So who are we to believe?
This is, I think, quite a complicated subject, okay? And the main message I want to convey is that science and scientists, okay, are basically, the process of science is inherently uncertain. Okay, if it's certain, it won't be science.
But we want certainty from you.
You can't have it. Okay, that's the message I want to convey. Science is not black and white. Science is constantly changing. Science builds on knowledge that previous scientists have done. Okay, and as you can see, this virus at the moment, changing all the time. Okay, so to expect science to tell the layman that this is fake, this is the truth, it is just not possible. The layman has to accept the fact that conflicting opinions among scientists is the rule rather than the exception.
But that's not very reassuring, Prof. Pangestu.
It's not very reassuring, but I think it goes back to a much more, let's say, basic problem, okay? And it is about what I call the science literacy of the average person on the street, okay? Do they know that scientists are not infallible, that scientists always get to the truth? That has to be inculcated, okay? Right from the very early age, from education, okay? Not just at high school level, even at primary school. If WHO or if one of these sites cites a study, one study has 10 participants, the other study has 20,000 participants in 10 countries. Which one would you rather believe? First example. Second example, okay? If you say you had a new drug to treat coronavirus, one study is done in healthy university students in the United States. The other study is done in China in patients of an older age group. Which one would you rather believe? The one in the US or the one in China? That's called bias. Each study has a bias.
Isn't it also a fundamental lack of trust now that perhaps, 17 years ago when SARS was around, we didn't have that lack of trust in scientists, in governments?
Science and truth is under attack like never before. Look at what Trump is doing, denying climate change. And he's not the only one. Okay, so it's all the more reason that scientists have to really stand up to say that, at the end of the day, look at the evidence. What does it tell you? Be a skeptic, because populism and nationalism will always choose bad science or even no science, just pure ideology as a way of defending their decision.
And that may be actually costing people's lives.
Another related issue is this dramatic fall in confidence in vaccines and immunization. That's absolutely tragic. In the Philippines, 400 children died of measles last year. That's totally unforgivable. Why? Fake news, parents got scared, they said, the vaccine is dangerous. So, who's to blame? Fake news, obviously, but the government should have been a bit more proactive to say, don't listen to all this. And I go back once again to what are the most reliable sources of information that has looked at the evidence objectively without looking at the hysteria side. Organizations like the WHO, which is able to assess the quality of the evidence, the accuracy of the evidence. Most of the UN bodies are about convening, countries getting together, collectively solving problems, coming up with suggestions that morally countries should follow. We all get together, we agree, epidemics are important, you all must do your bit, but we cannot enforce, okay? So the UN generally is like that. The quote from Ban Ki-moon, former UN Secretary General, and he said, the United Nations did not exist to take us to heaven, but to prevent us from going to hell. So think about that. That's the UN for you. That's what I still passionately believe in, the value of the United Nations.
So you're saying that the WHO, which is the United Nations health arm, is still better to have them than not?
There is no other alternative, Lynn. There's no other alternative. And, there may be criticisms, but when I joined WHO in 1999, I walked in the front building. In front of the building, there's the mission of the WHO. And until today, I still passionately believe in it. What is the mission? Okay, to attain the highest possible level of health for all people. To me, that's about equity. To me, that's about human rights.
Prof. Pangestu, thank you very much for being on In Conversation.
Right. Thank you for the opportunity. It's been a pleasure.